I have had Atlantic Pro Care here for 33 years. We have a prosthetic and orthotic practice where we treat patients who need prosthetics and orthotics of all types. We have a traditional method, which is plaster of Paris. The clinician spends a period of time out of their patient hours to be able to rectify all those models. And we're finding with the digital workflow, we've used comb and iPhone type acquisitions. We also used the tracer CAD scanning technique, and we were finding that our fits were not as accurate as we wanted them to be. We really want to make sure that we have as accurate as technology can offer us. And a lot what Shining 3D has offered is more accurate tools to acquire that scan so that we can provide our patients with the best treatment possible. In the case where we have to use that scanner outside of the exam room, perhaps in the hospital, maybe in a clinic, a patient's home, it might be very useful to not be tethered by cords. It gave us a user interface on a touch screen. It gave us the ability to enter the data that we normally need to do on a keyboard. And the beautiful thing is it's brought right into my software where I can then manipulate it and change it in an accurate and efficient way. That can be done anywhere. That can be done on-site, it can be done off-site, it can be done by someone else. I want to deliver care that's highly effective and really wow them with our care, because we took the time to know them, understand their needs, and provide them that level of mobility they may not have had without us. People overlook the importance of scanning. They'd much rather use their iPhone and get a quasi-accurate scan because honestly it's as good as taking a cast. But now we're looking at scanners that have higher levels of efficiency with higher levels and ease of use for us. So we'll have an easier time taking that scan and we'll have a much better result. Then when I do go to the rectification process, I'm rectifying something that's accurate, right? So there's a much higher likelihood that we'll have better outcomes over time. Consistency and reproducibility can't happen without accuracy. So we need to be consistently and reproducibly accurate with our outcomes. And honestly, we have very few outcomes that we can trust, and none of them are easily quantifiable. In a digital workflow, they all are, and that's where we're headed. That's why I want to own the Medixa, so I can start my process of digital workflow off on the right foot.